So I think let's start. Welcome, and my name is Sohail Tandon. I'm the director founder of Pro Sport Development. Pro Sport Development is a social enterprise that uses sport for the holistic development of children and youth. We are organizing this webinar in collaboration with PRIA International Academy. PRIA is a global civil society organization specializing in participatory research and training based in New Delhi. And PRIA International Academy is the education wing of PRIA. So all of you joining us would have received some information about the context to this webinar, and obviously the context is pretty clear. The entire world is going through a crisis due to the COVID-19 pandemic, and we all gathered here today to basically discuss what the impact of this would be on the sport for development sector, and what challenges the sport for development sector and its practitioners are facing during this time. But it also will provide us an opportunity to look at the future, what are the solutions to these challenges and what are the opportunities moving ahead for the sector. Before introducing our panelists, I would just like to inform everyone that we're going to open up a poll question for everyone. So if all of you could possibly just participate in that will be great. We have our first panelist is Mr. Juan Pablo Ramirez Miranda, who is the head of Social and Human Sciences at UNESCO New Delhi Cluster Office, which serves Bangladesh, Bhutan, India, Maldives, Nepal, and Sri Lanka. And his current focus in South Asia is on youth, sports, gender equality, and social inclusion. Welcome, Juan Pablo.
Hi, Sohail, and hi, everyone.
And then we have Ms. Laura Prabhu, who is the executive director and co-founder of Sequin, which stands for Center for Equity and Inclusion. It's an organization that utilizes football as a tool for the development and equal rights of women and girls. She is also co-convener of the National Alliance for Women's Football in India, which is a very unique alliance for women's football in the country and to drive that ahead. So very warm welcome to Laura. And we also have Mr. Deep Narayan Chakravarti, who is the head of program development at Magic Bus India. Magic Bus is an organization that works with children and youth to take them from childhood to livelihood and out of poverty. And they use sport as one of the key tools in achieving this mission. Thanks so much, Deep, for joining us.
Thank you, Sohail, and hello, everybody.
And we also have Dr. Kaustav Kanti Padnopadhyay, who is a commentator today, and he's a director at PRIA and the head of PRIA International Academy. He will be joining us to give some of his views as the webinar goes ahead. We just have, so without much ado, I think we're going to start. Just a couple of things for our participants. Basically, if you have a question, there is a Q&A box as part of the Zoom platform. So I would request you please to type in any questions you have there. We'll be taking questions throughout the webinar. Some of these will be from the platform where you put in the questions. We'll also try and take a couple of live questions as well. Yeah, so I think let's start. I think it's great to have all of you here, and obviously the crisis created by the COVID-19 pandemic has impacted various sectors, and sport for development is no exception. So I think we should start with what has been the impact of the S4D sector, but also what is the long-term impact of this crisis on the sport for development sector as we move ahead. So I think I would like to start with Laura and get your thoughts on this.
Thanks, Sohail. Thanks for inviting me to this panel and very important discussion. And you really asked me to speak in the context of women and girls wearing that gender lens. Um, I think we are all kind of very aware that the gender impact of the COVID crisis is going to be huge. Already, the UN Women's Study talks about the shadow pandemic, the huge escalation in domestic violence, and in the context of the fact that girls anyway didn't have access to public spaces and had limited mobility. So, sports for development was such a wonderful, unique tool to be able to overcome that challenge. So it's a big struggle because it's not really very, out of the ordinary, right, for girls to be trapped within their homes, because actually they are going back to the old stereotype. So that's a challenge that we face. There's a huge challenge in terms of how we're going to go forward, because there's a massive gender gap in digital access as well. So how we're going to reach out to those girls and to those women who are going to come out to participate in itself is a challenge, because you're not able to communicate with them always. So there are many challenges as we move forward. How is the pandemic playing out within the communities where we work in? There's a huge crisis in terms of access to health, institutional, resources to help the reproductive health. It's a challenge, for women to get to reach hospitals for deliveries, for example. There is a challenge to get sanitary napkins to girls. Yesterday was the menstrual hygiene day, and it's a massive crisis, because we've been working really hard to get girls to start using sanitary napkins, to get them accustomed to behavioral change. But the thing is, now you're in a situation where you're not able to give them the kind of products that they need to be able to increase their personal hygiene. There is no water, congested slums. So when you're talking about social distancing, it's really, there's a huge gap between what we talk and what there is in terms of reality, and it affects girls in a very significant manner. We are very concerned how this is going to play out in terms of girls' dropout rates, for example, because if schools are going to go online, and if you have like one mobile phone to a whole family, we're already seeing that it's, that limited time where it's given is the phone is given to the male child, who quickly gets his homework done. So the girls completely left out. In such a scenario, how we're going to get the girls back into the playground is going to be a big challenge as we move.
Excellent. Thanks a lot, Laura. I think that's very important to look at this from a gender lens, and I think you've provided a great insight into that, especially in the communities where you work. So maybe I can now move to Deep, to get your thoughts on the same, especially in terms of, the impact on S4D programming. So Deep, if you could please share your thoughts as well.
Yeah, thank you, Sahil, and great to be on this panel and speaking to everybody. So I just want to add to what Laura has already added, and a lot of it is now common understanding. There is economic impact of this pandemic. There is gender impact of this pandemic. There is health impact of this pandemic. And we have seen there is food, nutrition, impact on food and nutrition. So I would like to answer this question a little bit in detail, because I think the next issues also will be related to how we are seeing the current issues. So we did a survey of around 4,000 parents and adolescents to better understand what the impact of the pandemic is on children and their families. And one of the things that is coming up is that parents are saying they are missing midday meals. And around half of the parents are saying that, without midday meals, they find it difficult to manage. Uh, Children, they are spending time in front of TV quite a bit. However, what they miss most is visiting their parents, visiting their friends, going back to school. And there is a lot of isolation, sense of isolation that is coming up. And the existing gender fault lines, like Laura was mentioning, they are deepening. So we see that household chores have increased, and girls have a disproportionate share of those additional household chores. Around 14% girls said that they're getting comparatively less nutrition. And adolescents overall are anxious about getting COVID, contracting the infection, and very importantly, family income and family livelihood. So all of it together, then we see from a, say, on the perspective of children, it's a very varied, broad-based response. And from, say, a programming perspective, although April and May, they are mostly summer vacations all over, we usually do summer camps, but there, of course, we can't access children, and we didn't have earlier, uh, we did have a database, but we didn't have a proper database of phone numbers. And now in our survey, we found out that there are regions where there are a higher number of regular phones. You can't access even through phones, even in say regions in East. All of this together has created an issue of accessing the children themselves as a, I would say that is a major threat and major impact of the program. Next is philanthropists and funders. They immediately move to a food and health kind of a focus, and for that a lot of funding, as we all know, moved to PM Care Trust and all those areas. What happened was that there is a bit of a gap, there is a bit of a scarcity of funding and focus on the regular S4D field. Thankfully, we have been able to manage and retain most of our partners and supporters, but we have seen this change in focus on basic food delivery, basic, and rightfully so, because that was a huge need. And another part that we see is that in our communities, we have seen, so when you do a program with a certain number of children, but a huge lot of migrants are coming back. And with them, they're bringing back a lot of children. And we cannot just sit back and say that, okay, so we are not funded for these children and we cannot do anything about it. So we are feeling increasing pressure to increase our outreach at the same funding and reach out to these children who are coming back and who are very vulnerable. So, to think from a, say, staff and organization perspective, our organization quickly moved towards relief distribution. However, it is not something that we do. And as for the organizations, I'm sure many of the organizations are forced to take up on much more basic needs of the communities that they serve, because just to address their more immediate concerns, and their concerns like the safety of our own staff also is one of the major things that we are thinking about. So it has impacted children, communities, funders, programs, our organizational focus, staff, processes, everywhere. It has been, people are saying that it's once in a lifetime event. It is truly a black swan event.
Thanks, Deep. Yeah, very interesting. Obviously, in a time like this, the focus is rightly so, as you said, going back to basic needs of people. And S4D sports and S4D are taking a bit of a backseat. Um, I'll just move to Juan Pablo. Just get your thoughts on sort of the wider impact, especially on the sector and on sport as well. UNESCO has a big focus on sport, physical activity, and physical education.
Yes, thank you very much, Suhail. Good afternoon to everyone here, to all the participants to this webinar, to my fellow panelists. I thank you all for attending this session. I would like to begin by thanking, of course, ProSport Development and PRIA International Academy for hosting this webinar and for having us. We are a close partner on these important issues. And I mean, of course, UNESCO is the specialized agency of the United Nations for Education, the Sciences, and Culture, but we are also involved in encouraging people to do sports and to have a healthy life. That is why I am here to represent the Social and Human Sciences Program for South Asia, which currently has a focus on youth, sports, gender equality, and social inclusion. Of course, targeting a broad range of people in situations of vulnerability that have been affected by the effects of this ongoing pandemic. What all of these areas have in common, and to respond a little bit to your question, is that these are all interrelated when it comes to sports. I would like to second what my previous fellow panelists have said. There's specific impacts that are having an effect in some people, just like, for example, women and girls or migrants, as it has been rightfully said by Laura and Deep. And I think the key issue that we need to understand is social inclusion. Social inclusion is a key aspect of sports for development, because of course, everyone here and everyone joining to this webinar is already convinced of the power of sports for development and understands how sports can be a leverage for development. And particularly when we're talking about sports, we're talking about people. When we're talking about sports for development, we're talking about those that are left behind and how we can bring them together into development using sports as a tool. So this is, of course, a fairly recent phenomenon. And while we were all already advocating for the power of sports for development, we have now this pandemic. We are, as an organization and with all our partners, working every day to give advice on how to use sport activities during confinement and quarantine. And of course, we are firm believers on sports as a leverage for the accomplishment of the SDGs. And the 17 Sustainable Development Goals have, of course, aspects related to individual and personal development and how we have to change our behavior and our patterns in general to achieve sustainable development. Not only development itself, but sustainable development too. And now we have the pandemic that will certainly have an impact on development priorities. As you were saying in your question, Suhail, so the focus will be shifting to public health, which it's natural right now as the pandemic is unfolding. We will have the development agenda will be focused more on those aspects, on public health. But of course, the natural aspect that we need to promote from the sports for development perspective is that sports is a leverage for health. So if right now all of the attention is focused on health, and we are seeing that one of the comorbidities that affect people who are struggling with COVID-19 are related to a lack of health that can be promoted to sports, that is our first and foremost important tool to promote, not only for the general public, but for those specific target populations that are affected, as Laura and Deep were saying. I think specifically of girls and women, migrants, and all of those in vulnerable situations. So as during this crisis, our health is recognized as most important asset, we most strongly emphasize the power of sports for health. And this is not only the physical health, but also mental and well-being, because we need to consider the impact that lockdown quarantine has also on our mental well-being, and how sports can contribute to those aspects of the pandemic. There is no doubt that the COVID-19 pandemic has a tremendous impact in all of us, limiting our access to education, to culture, to learning, to socialization. And this is essential for everyone worldwide. When you see that even the Olympic Games have been postponed, you realize the magnitude of the global impact in sports and in societies across the world. We are not used to being indoors for long, and we are, of course, deprived of normal training facilities. And that is one of the questions that I saw that one of our participants has already asked: how can athletes continue training? And this is, of course, challenging for everyone in the sports industry, for the team sports, but also in the grassroots sports level. At the same time, we need to understand, as I was saying, that these current circumstances provide us all with also unprecedented opportunities to overhaul existing sports policies, and for all of us to advocate together for sports policies to be used as a leverage, not only for public health, but for personal development and for societal development as a whole. We need to create an inclusive and structured way forward, targeting those specific groups that need special attention, but also establishing skill hubs that would encourage people to play sports, to develop sporting skills, and to continue with virtual social interactions in this, for instance, in this time, but also as we move forward to use the new normal as a way to favor physical activity and sports. So yeah, in closing, it's about devising creative strategies to cope with the challenges and raise awareness on how we can adapt sports and physical activities to this pandemic.
Thanks, Juan Pablo. Excellent thoughts there. And, I think very relevant, not just for during the quarantine, but, looking ahead, what are the envisioned challenges and what we need to do moving forward. So what we'll do now is if any of the participants have a question or would like to make a comment, there's a function where you could raise your hand and then we could get you live. In the meantime, there have been a few questions, so I was just looking at it, and we've got a few good questions. I think two were pertinent. One is about, obviously, funding moving towards more basic needs at this current point. How do you see what are the for S4D and for sports, especially, what do you think funding does look like right now? What has been the impact on funding, but also in the future? I think that was one of the questions. And then, we've got another excellent question. Obviously, the lack of physical activity is challenging in the short term, but what might be the impact in the future as to non-communicable diseases among at-risk communities? So we can, and those questions are from Rachita Mukherjee and Pradnya Haldipur. So maybe we can answer those, while if anyone has a question from our participants, if you could just raise your hand and then we can get you in a couple of minutes. But maybe just to answer those couple of questions, any one of you.
It's essentially about keeping your mental health, and it's a situation where everyone's really taking stock and kind of, it's like a rebooting. And it's good to do that. I mean, let's have a positive approach to this entire scenario, and let's just go back, do some rebooting, and come out fresh. You know, if our mental health is in place, and there are so many, as JP was talking about, so many ways in which you can stay, you know, within a lockdown, to be able to look at your personal mental health and physical fitness, you're going to bounce back as soon as things, you know, even if it's not new normal, we are going to get back. We are going to get back. Maybe it'll be a different word, but we are going to get back out there. So if we keep our positivity, I'm sure we're going to bounce back.
Deep, JP?
Yeah. If I can come in here. Excellent questions, both. So for the one about, say, non-communicable diseases, say like diabetes, cardiovascular diseases, activity is important, of course, and mental health, like Laura and Juan Pablo have spoken about. So one of the things is that we have to see this also as a matter of privilege as well, right? So having the space to do these activities in your home, or having the expectation that you can do certain kind of exercises in your home, is a function of how much space do you have in your home and how many people you are living with. So this definitely you know, doesn't have an easy solution to this. Even when we are trying to, say, get in touch with parents and asking them to do certain activities at home, it is easier said than done. And probably, for example, like many organizations are doing online yoga, online Zumba classes, doing live streaming of activities which people do, and they do it at home. That itself is a good opportunity. However, in our estimate, say in our survey, around hardly 20 to 30% people have smartphone and internet access. So it is accessing people during lockdown and communicating and getting them to do something about it is, you know, there is an ideal way of doing it, but we have to acknowledge that there is a whole lot of resources and privilege that goes in there. However, as this goes long term, we are exploring these methods of communication, these methods of promoting activities at home. In say rural areas where you know, people live a little bit more spaced out, there things are a little bit easier. With regard to the question on funding, moving to other things, I think what Juan Pablo said, that the focus is on health, and in a sports for development community, we say that sports promotes quite a few things. And in that basket of things, we have stuff like inclusion, we have stuff like soft skills, leadership, and of course, health and fitness. What it would be very easy for us to do also is to promote this primacy of health and promote our contribution to that. However, to do that kind of work effectively, you need that space to do those activities. So there also, we are at the mercy of having access to space. So that's what I say.
Suhail, I would just add there that, of course, I totally agree with this being a big challenge. And yes, the issue of promoting sports and nurturing the love or the commitment to physical activity in people, this is something that for everyone in the sports for development community, for all of you here, for all of us working in sports, preceded the pandemic, of course. And yes, we feel that we who understand the value of sports, we feel that it would be natural for everyone to be focusing on promoting physical activity and sports, as I was saying, to reduce all the issues related to comorbidity that can be counterbalanced by sports. But yes, that is being done. I mean, we have all seen how our colleagues from the WHO have issued guidelines for the importance of physical activity, and that they launched this campaign that is called Stay Active or Be Active. We have, in terms of promotion, we have the same type of challenge that we were having before. I think that these calls, if we were already practitioners and a community that required a lot of creativity to have incidents at the public policy level and at the local level too, I think that this crisis is calling for us to have and develop more creative solutions for these issues. As Deep was saying, this is an inclusion issue. We cannot solve everything thinking that like with a smartphone will be automatically there, because of course, there's a lot of people who won't have access to stable broadband, to data connection, and to all of those privileges that all of us here connected to Zoom today have. And yes, I totally concur with the issue of space being a problem. For those of us who like practicing yoga, yes, we just need the space of a yoga mat, but there's also many of other activities that require more space. And of course, there's some people who don't even have the capacity in shared spaces, etc., to use the space of a yoga mat for their private practice in a long time. So again, this calls for creative solutions that go beyond technology, but technology can definitely be a vector.
Can I add to that also?
Sure.
The thing is, this entire space, we have constantly been dealing with challenges. Where has there ever been space? Like when we've done our football, there's never been space. It's always been an issue. They don't have the gear, they don't have the nutrition, So I think we are really well placed to deal with the challenge. In the sense, I'm just saying that all the things that you point out are real problems. You don't have, as I said, you don't have access to sanitary pads when you're menstruating. Obviously, there's no question of expecting somebody to go out and do exercise. So of course we have the problems. But I think the wonderful tool that Sports for Development is that it gives the kind of resilience to kind of deal with this issue. Because I just want to flag that our program in Jamia, the football girls who are part of our program are doing amazing work being our volunteers in the community, because a lot of our relief activity work is being done by these girls, and they're like real leaders, because the sports program has helped them to develop those kind of skill sets. And absolutely, as I right at the beginning pointed out, the biggest challenge to reach out is going to be the digital gap. That's what I think all of us organizationally have to, all of us I think are busy just tracking all our girls, getting their mobile numbers, and I realize that it's such a big task which we probably should have done earlier, but we're literally going back and, tracking each and every girl and, putting our groups together. So it's going to take time, but once we're able to connect to them, hopefully, if we are able to share best practices, we'll be able to devise, ways to reach out to them.
Thanks, Laura, and thanks to you all. We have a few hands up, so we'll try and get one question before we move ahead. Mohsin Ali, Mr. Mohsin Ali, if you have a question, you can please go ahead now.
Thank you for giving me the opportunity. I am Mohsin Ali from Bangladesh, with a civil society organization named Wave Foundation. We have an observation that after COVID-19, both the poor peoples and the middle class peoples, even upper class peoples, adolescent and youth, they are suffering from mental and physical health problem because of staying in home from too much time. I can give you one example. Some of the youth in Dhaka city raised a question to the media that earlier he had taken drug, but once upon a time before, uh, uh, not before, but too much before than COVID attack, he left the drug. Now he is a good man, but he is thinking that in that way, whether he will take further drug or not. So one of the example of mental, there are lots of that. So all activities by government and CSOs and others are going to food because it is practically problem in our country especially. So I want to know any good example with a very few cost or something like that, that for adolescent and the youth staying who is home in safe, how they can develop their, or they can develop their physical and mental health. Is there any example activities in India or anywhere?
Thank you, sir, for your question. I'll just open it up to the panelists to reply to that.
So the question was about, I mean, you were saying how you could keep youth away from drugs and that kind of behaviors in the mental health context, right?
Yeah,
I think that's, it is a challenge. It's a huge challenge with young people, particularly when they're so used to being outdoors, to be stuck at home. I think it's a phenomenon that everybody is dealing with. And there are tools. I think there are a lot of mental health organizations who are giving online counseling sessions, but it's not adequate. And that's why through, I mean, organizationally for us, we really actually discovered the digital medium so effectively in the last couple of months. See the way we are doing our Zoom meetings. I mean, we have programs, you know, in remote parts of the country. We have like our office in Ghasera Gaon in Mewat, and we have all of them coming on Zoom. So I guess there's also some kind of a positive side to the whole thing. I think organizationally, if we are able to get youngsters online into webinar spaces, into interactive spaces, you'll at least bring the world into their homes, probably actually give them even greater resources than they ever could have envisaged before. But of course, the digital gap is going to be a challenge. And I think that's going to be a prime thing that we all have to work towards to bridge the digital gap. But once you've plugged it, there is the world, you know, to access.
Okay, can I?
Yeah, please.
I mean, I just wanted to add that, like, of course, this was very relevant before the pandemic, and this is very relevant, especially after the pandemic, because your question, sir, touches upon one of the greatest impacts that this will have on young people, that it's less opportunities for young people related to employment, related to development, etc. So, of course, this goes back, number one, as Laura was saying, of harnessing creatively the technologies available for youth engagement, but also this goes back to how important is to address sports for development at the grassroots and community level, because for these young people to be engaged when they will not be able to find opportunities in the medium term, because we are still seeing like only the beginning of the socioeconomic impact of this big post to the economy, what that will have in every country, no? So when opportunities will be reduced, we need to advocate and promote at the community level a thorough response, and again, sports can be a very valuable tool to engage these young people that will be struggling with the socioeconomic impact of the pandemic.
And if I can come in here, and thank you, sir, for asking that question. What I strongly agree with Juan here is the term engagement. And the sports field is a huge space for engagement. Now, because we don't have that field, or because we don't have that digital access, it doesn't necessarily mean that we can't engage. For example, if in communities we are seeing this not uniformly, but in many places, if we are able to activate our community volunteers, youth who are also stuck at home and who can get access to these children, 1, 2, 3, 4, and just remain engaged with them, or our community coordinators who are a little older. So they just get in touch, not like a group, but just in areas, in green areas, green zones, just are trying to say hi, say hello, because one of the reasons, you know, supposedly delinquent behavior or this kind of substance abuse happens because of the loneliness and anxiety that youth and children are going through. So being connected either through community volunteers or through phones, because we are not able to, is something really important. And in India, there are quite a few organizations, I'm sure in Bangladesh as well, that are offering counseling. Now, these children, these youth may not call up those helplines. So these community volunteers are will appear to be playing a very critical role in connecting these youth, at-risk youth, vulnerable youth with these kind of helplines. We called up the national helpline that was established in India, and we asked them that, you know, these children, they won't call you. Can we call these children, talk to them, get their issues, and can you help us, you know, sort of respond to these kinds of issues? And they said, yes, we are okay. You come ready with your issues, and we are not counselors. We have no experience in counseling, but whatever way we can reach to children, to youth, adolescents, is the way, and engagement is the way, like Juan said.
Excellent. I think those are all very pertinent points. And I think the questions, we've got some excellent questions that are more coming in. And I think we've organically already moved into the second part of what we wanted to discuss. Basically, you know, whether the S4D sector requires repositioning in terms of its strategic approach, you know, after the initial lockdown and quarantine period of COVID-19. And, you know, if so, then how? And I think all three of our panelists have, you know, already started discussing that. There's also a couple of questions that have come in, you know, is there, so one question from Neil Sood is about, you know, what area of society just should S4D focus on moving ahead? And again, we have another question from Lisa asking about, you know, in terms of girls, working with girls, what are the issues that they face that S4D should focus on moving ahead? So maybe, you know, three of you could just take this conversation forward, and you know, how should the S4D sector reposition, if at all, and you know, what are the new focus areas?
Yeah, I have a rather drastic view on this. I just feel that sports has always been this top-down, corporatized approach, and it's time to just make it upside down. This is it. I think if there's a future in sports, it's through the way we work. It has to be a grassroots, community-based engagement. That's the future of sport. Because I don't know how it's going to be in terms of big money, large stadiums. You know, sports is all about participation. It's all about going out there and feeling that game. And if there is at least in the near run, for sure, it's a, you know, grassroots sports is the most critical, because if you don't keep that engagement going, you can't have curated events, elite events on top without that base. So I definitely think there is a future for sports for development, a very important one in that, because I think sports is going to play a very, very critical role in the kind of psychological healing that we're going to have to go through, and it's going to take some time. getting back to your groove, getting back also, the kind of impact it's had on communities with this social distancing. This whole thing about social distancing versus physical distancing, even terms like that do psychologically have an impact. How are we going to come back as communities? How are we going to engage with each other? How are we going to engage with our neighbors? It isn't just about the economy, it's about how we as humankind are structured. And there I think sports has to play a very critical role in that healing process. Therefore, I definitely, it will be a challenge, but you're going to evolve and find ways to do so. But having said that, right now, today, it's going to be hard to envision how long this kind of lockdown mode will be, whether it'll be a few months or a year or so. But it will take its course and we'll come to some space. But I think we will probably evolve and adapt, but we're going to play a very critical role in how we shape up in the near future.
Any focus areas for girls that you envision S4D should look at, maybe in 6 months, 12 months time, or 3 months time?
We are very concerned about girls, like very, very concerned. It's across the spectrum. I'm very concerned about girls dropping out from school. That's my primary concern, because you see, if schools are going to go online, we are really closely tracking to see, and I can tell you that with the little bit of research that we're trying to do, run our surveys and getting a feedback, no, the girls are not getting access to those smartphones. It's the brothers who are getting it. How is it going to pan out? How are they going to be retained in school if schooling is going to be online and there is such a big gender gap in digital access? So that's a huge concern. The minute a girl drops out, we've lost her in many ways, because it's really hard. It's a struggle to, minute a girl comes out and goes to school, we have access to her to do a whole bunch of things. And, like in places like Mewat where we work, it's such a huge struggle against child marriage. Even today, it's a reality, right? A large number of girls get married before the age of 18. And if they drop out, then these are the real issues that you're going to have to deal with. So, we are very concerned to keep the girls, going, in school, and we are equally concerned to get them out to play. We're going to track them very carefully because, as I said, girls' mobility, the way we approach our sports for development in the context of girls is to enhance girls' mobility and access. That's the main core thing when we work with girls. And so in a lockdown mode, if they're going to withdraw, it's a crisis. We have to get them back on those fields. And how are we going to do it? How are we going to be able to look after their safety? We're going to have to figure it out. Also wanted to flag to you that the Women's World Cup, FIFA Women's World Cup under 17, which was scheduled for November this year, has now been rescheduled for March in 2021. Now, I don't know if that's a good thing or a bad. In the sense that they were not in such a hurry to reschedule the men's matches. The girls' match has been rescheduled in a hurry. So is that going to mean a compromise in the way the girls are prepping for the event? I don't know. But on the other hand, I also think it's an opportunity, because if we are able to send that message out that these girls are coming out and playing, we're going to be able to use that effectively to hopefully bounce back. We'll have to see how it goes forward, though.
Excellent. Thanks, Laura. And if I can just move to Juan Pablo and Deep, especially JP, to you, what Laura said, turning the whole, how sport is viewed upside down in terms of grassroots community sport taking precedence. Should there be a greater focus on advocacy or by the S4D sector and by other stakeholders? Just something I had in mind.
Well, the first question was about from a program implementation and how S4D organizations will look at their programs perspective. And of course, one more point you added was, how do we make it more broad-based, make the S4D, use this opportunity to make S4D programs more broad-based and instead of a top-down approach. So I'll answer the first part first, about, say, how we are looking at, say, from a program implementation perspective. So first thing is having, as an organization, having a plan is really important. Although it seems very intuitive and obvious that you must have a plan and everybody works according to a plan, but a very ground level, detailed plan, region specific, zone specific. Now we have red, blue, orange, green. This kind of zone specific plan is important, because what we are saying about the issues, difficulties, say logistical issues, it's not, India is not one country, right? Even before pandemic, we knew that every region requires a little bit of a different approach. And now it has become more important, because what is true in green is not true in red at all. And it will be like two different programs. We are seeing in our continuity plan, we are seeing, we are talking to governments, etc. September, October is the interim stage where we'll have to manage, and post September, October, we can hope to go back to normal. And this is what we have communicated to our partners and our teams as well, and our communities. So for September, October, what we are looking at is how do we address the issues that are coming out of this pandemic better and more. So for example, health and non-communicable diseases and simple COVID prevention is something that we are focusing on. And from an implementation perspective, we also see that repurposing your program is not an option. It is a necessity. Governments are repurposing train coaches to make makeshift hospitals. So repurposing your program to first look at COVID prevention as a message for a second wave prevention is something that we are strongly looking at. So from a, say, programming design perspective, we are front-loading health issues like Juan Pablo said, but not only, say, non-communicable diseases, but primarily the diseases, the disease at hand, and of course, mental well-being. Connecting with helplines is something that we are looking at. When, say, from a going ahead perspective, if you are looking at a school or in community, even if, say, from June onwards or in September, August, in some locations, schools will open mid-June, mid-September. So there is, we are hearing 50% syllabus cut, 50% attendance, odd even attendance. It is very unlikely that in a school, sports and assembly functions are being banned, as in there are enough newspaper articles doing the rounds, and we are hearing from teachers, headmasters that they're definitely planning to cut assembly and any group gathering. So in that case, we are thinking of smaller groups, small group activities, and moving to communities. However, you see, when you are working in a school, children are coming to the school, but one school, and you go to one school. But if you are working in communities, to track those children, they come from 10 villages. So you'll have to spread out, and there are issues of resources there. However, we are planning to work more closely in small groups in communities. And more importantly, the experience that the children go through, which was probably a football game or a handball based activity, or any activity which requires close contact. So those we'll have to repurpose and repurposing again is the, as in going forward from a, say, program messaging perspective, program experience perspective, we have to repurpose. We are incorporating methods, newer methods like storytelling, role play, because say a smaller group of 7 to 10 children coming together, now we don't want them to pass a ball at this stage, because we don't want them to you know, pass on any possible infection. So what, and we are testing out how can we have activities, how can we have this sense of physical distance, yet a sense of a group coming together. So repurposing the activities are very important. And pure play, safety of our staff, of our children, safety from the perspective of simple washing hands. Laura has been very descriptive about the challenges that we face anyways. Schools often don't have water. People in urban slums, access to water is a major challenge. That's where we are trying to focus on ensuring at least everybody washes hands, even if they're coming in a small group. Now, after September and October, we may assume that, you know, things are back to normal, but they may not be, right? Because their CDC, WHO is saying that there may never be a vaccine, and this could be something like a flu, which will recur and which we'll have to live with. So there will be some fundamental changes, like, you know, how you touch, say, when you're even in an activity, do you do high five or not? Do you shake hands? These fundamental behavior changes, we are you know, in the process of creating certain guidelines as well. Where we see a very strong opportunity is, since we work with adolescents and youth, we can have them as ambassadors for these change, have them as ambassadors of this change to prepare for COVID, to generally make have better health practices, exercise, and that's where a strong focus of program implementation would be. So again, and I want to connect this part with what Laura said and the question of advocacy. Now we have advocacy at various levels, at say at industry bodies or at government level, at say district magistrate, that kind of a school education system level. We have advocacy at panchayat level, and of course advocacy as at community and family as well. So when we, and I completely agree that when we are trying to broad base it, we'll have to do this advocacy. In our experience, we find that, you know, trying to work downwards from a, say, central government or a state government level, things move not as fast as one would like them to. However, when you start working with, say, district education officers, or say with panchayats, so there is greater relevance, because there is a stronger sense of autonomy and greater adoption of initiatives, and they have actually a lot of leeway of promoting, and they are in this current pandemic, district magistrates, district authorities have a huge amount of authority to allow or disallow certain kind of activities. So this is the right time to partner with government at a district level or at a panchayat level as well, so that we can create ambassadors not only in children, but ambassadors in a, say, a district magistrate who sees this as something important and not as a potential threat. Because right now, well, any public gathering has a little bit of a negative branding, and advocacy will sort of, it's not an option. It is absolutely necessary for us to reach out and remove this negative branding, for us to continue even at a, say, at a group sport level or at or at a community sport or participation level.
Thanks, Deep. Excellent thoughts again, and very comprehensive. Juan Pablo, if you could please share your thoughts as well.
Yes, I mean, of course, I cannot but agree with what Laura and Deep have been saying about how we need to adjust and adapt, because of course, like the consequences that this pandemic is having in our economy, in our societies, in our way of life are only starting, and we need to, of course, take every aspect of it into account. My message particularly is to recall what UNESCO was saying as we celebrated. You all must know that we celebrate International Day of Sports for Development and Peace on April 6th. This year was Monday. And actually, I would like to recall what our UNESCO Director General said on that day on her message, Audrey Azoulay. She said, "We must keep physically active because exercise is essential to good health and to physical and mental well-being." This we have already said, we have already touched upon that, but here the key word is essential. And I think that is not only part of the advocacy that we have to bring to the table and to the partnerships that we need to continue to establish to reorient our operations, but to advocate for how this is essential, that this is not a part of the economy that needs to continue to be stopped or locked down. There's an issue of space, there's the issue of infrastructure, there's an issue of opportunities. But if we consider this as an essential part of the economy, we have to reopen as soon as possible. And also to address other sides. Laura was very descriptive on the challenges of all of this. And I also want to address another side of the coin on the opportunities, because this situation obliges us to look at the values that we can promote through sports in a different way, like never before actually, because the values of solidarity, inclusion, fairness, sharing, pushing one's limits, discipline, all of these values that we usually and traditionally promote through sports are the ones that have made our societies go through the lockdown and through the quarantine. All of these values, being fair, being respectful of others, being disciplined, are those things that we through sports promote in each person. So right now it's one part of the message that we need to bring these values into the conversation as those that allowed us to go through the pandemic, and of course those that we will need to adjust in the scenario that's coming along. Of course, our call to sports organization threatened by the interruption would be exactly what Deep was saying, to reinvent the operations and for programs to be reoriented to respect the new guidelines and restrictions. Of course, we need to innovate to promote and practice sports that not only can be practiced at home, but that can be practiced by respecting the social distancing measures. This is already happening across the world, and I think it is time for all of us to start doing a collection of practices that have been successful in other places, not only on online courses, of course, because as we have said, those have their limitations, but also I think that there's a lot of potential to send out the message of how there is pleasure in keep moving and all the benefits that this can promote across our societies. So this might give us our opportunity to play and do sports with different people and across borders, because of course, as the virus is not respecting borders, we understand that this can also be for us to broaden our perspective and to practice sports across borders too. And finally, a note on people with disabilities, no? Because of course, they usually struggle specifically with the practice of sports and games, and now they may find it harder with all of the mobility constraints. So of course, we need to also remember that physical activity and sports are a need for persons with disabilities, and that caregivers and parents need to mind the practice in that regard. UNESCO has published with Calicut University, with the Center for Management of Community Disabilities and Rehabilitation, a very interesting guide that reminds of the importance of sports and physical activity for people with disabilities. And that is why programs and practitioners need to also incorporate this into their repurposing, their orientation of operation, and as an added value for the impact they can have on development with an inclusion perspective. Because of course, sports, we need to understand it as a powerful leverage for leaving no one behind.
Excellent. Thanks. And this is all very useful. I mean, lots to think about. We don't have all the answers as of now, and I think we need to, as a sector, you know, go back and understand how we move ahead. But these are some very crucial points. And I think just a last thought from the three of you before we sort of take a few more questions and then wrap up. You know, you've laid out what sort of needs to be done, how you envision the S4D sector to, you know, reposition in after the lockdown and, you know, as part of the repercussions of the pandemic. Just a follow-up question is, I mean, what role do you envision different stakeholders to be playing? Civil society, social enterprises, donors, philanthropists, and governments. So if I could just, you know, get the three of you to share your thoughts very briefly, as we are running behind quite a bit. Please, maybe JP, you can go ahead first this time.
Yes. Glad to be the first. Of course, I mean, as I was saying, the virus does not discriminate. So our response, albeit I agree with Deep that our response need to be like tailored and addressed to the different levels of social distancing measures that will need to be established and like adequate our response to the reality. Of course, we need to not discriminate in the sense that this, again, as I was saying, this needs to be inclusive, this needs to leave no one behind. And we need to use this opportunity to change for the better, for sure, and become more inclusive and define a new message from sports as a leverage, again, as I was saying, for social inclusion and gender equality, and particularly at the grassroots level, as Laura has also been saying. We need to bring together, of course, all actors within the civil society, social enterprises, donors, local governments, and need to engage more than ever in sports. Most of the development arena will include and incorporate now a health component. That is for sure. The focus on health in development for the socioeconomic response will remain there. So we have the very good opportunity to package sports interventions on the health and mental health issue, so they can attract all of these resources that will be available for the socioeconomic response to the pandemic. So we need to think how to measure, how to define our interventions in terms of how efficient and effective they can be to address these issues from a socioeconomic perspective and the contributions that they could make in this regard. So we have also discussed how to use technology for sports and its benefits, but I think it would be the opportunity to continue working towards harnessing the power of technology and trying to bring it to those that don't have access to it too, of course. Our programs can be a leverage to providing this capacity to those that don't have it, and for us that already have it, to use it. This will, of course, continue to be limited interactions. We will continue to have social distancing for a while. So how close can the technologies get us? That's the question that we need to ask. So of course, we know that as something that is also related to the gender gap. Of course, the access that girls can have to technologies is also lower. And because their access of sports was also limited by many different aspects, and now that can be also a limiting factor, that when technology is not thoroughly available within a context, within a family, maybe girls can also be impeded to access that. So the gender component is to be also there for us to keep in mind. So basically, we need to rethink our lifestyle. We need to rethink the way we work together and the way we promote this, and what we were already doing previous to the pandemic, meaning the power and how sports can be a leverage for development at the social level, at the individual level. We need to now repurpose it for how much of a social good it can be in the building back after the pandemic.
Excellent. Thanks, Juan Pablo. Deep, Laura, would you like to add to that, please?
Yeah, just to kind of, one quick point, which JP's emphasized, and, we have to keep re-emphasizing that sports is going to be critical in putting us back together. There are so many fault lines right now along, communities, along the rich and the poor, along, the rural and the urban. There is so many fault lines. And then you have the pandemic, so and not just in our country, but the world over. It's a very worrying time as a global community. All of us, I think, are going through that, and therefore sports is something we have constantly said that, post-war situations, how do you use sports? And, we've been talking about all this. I think this is the time where sports is going to have more meaning than ever in terms of that healing touch. In terms of how do we feed it into our programming, it's always been a challenge, at least, from where we come from. It's always been a challenge in actually explaining and getting that kind of resources into our programs. But we have over the years tried to weave it into our programming, because as JP was saying that, you're talking about health outcomes, how do you weave it in? How do you weave it into your livelihoods program? How you weave it into your leadership and skill building programs? So we at an organization level for Sequin, we have always, had multiple outcomes that we fed into through the entry point of sports. So we have never looked at sports purely as just, playing the sport, but looking at the multiple outcomes. So we've got to be innovative, and we have to feed it into our programming, and how we're going to deliver actually on the ground. As we've mentioned, we've got to, one size doesn't fit all. We've got to have a very, very detailed programming in terms of, we've got to adapt depending on the situations. Many of the like, for example, that Bundesliga, I think the league matches have already started. They've begun playing all that. So it's interesting to see how you're going to balance, the risk factor with actually going out to play. And I think we are going to learn along the way. We've got to learn along the way. We've got to figure out how we are going to handle contact sports. We've got to make, devise those methods, and we are going to have to get back to the field, because it's essential. You need that vitamin D. Your kids need to go out to those playgrounds. How do you envisage public spaces? I think it also feeds in nicely to the environment, to our, in Delhi, for example, has never had better air than this, air quality than this. This is a time for us to go out to play football. And, when we were allowed to play out there, it was so polluted. So I think sports is a good entry point into looking at all these issues. Let's go out there and claim our clean air. I think we should link it to that movement as well, because how you're going to go outdoors if your air quality is poor. So I think integrating it into multiple things that we're looking at, I think sports is, we all on the same page that it's a wonderful tool to address so many outcomes. So we'll have to be smart about how you feed it into programming.
Deep, please.
Yeah. One of the benefits of going after, Juan Pablo and Laura is that they already have covered quite a bit of what needs to be said. I would just focus on what our expectation from the government would be. Stay invested in Khelo India, Fit India, all that we have invested in terms of marketing, infrastructure, everything. So stay invested in that. From the civil society, we need to balance the need for safety and engagement. So from a, say, a public discourse perspective, the conversation needs to move from, say, from the sentiment of despondence and fear to a solution perspective. How can we, because this is not going away. This is like accepting, processing your grief. And many people, as in I read psychologists are saying that our response to the pandemic is somewhat like our response to the grief, the Kubler-Ross model, where you accept that, accept the loss, accept what you have lost, and then, try to live with it. So that acceptance in public discourse from, say, right now it is anxiety, confusion, a little, like Laura said, fault lines are being completely blaming, each other for spreading the virus. Uh, from these to uh, a society, a community of cohesion who have accepted the problem and who are working towards it. And the summary for that is the sports person spirit. That's what we need, and that's what probably in articles, in media articles, in interviews, we need to re-emphasize that what we need is sports, what we used to call sportsmanship, the spirit of sports. And digital is, Juan Pablo mentioned that digital is the way, as in we cannot ignore digital. In our experience, it is, of course, and in everybody's experience, it is going to be phygital, physical plus digital. And I just a couple of days ago, I received an email about an e-sport convention that is happening. E-sports apparently as an industry has received quite a bit of a benefit from this pandemic. People have time and money to invest in that. However, even if, say, even if you are looking at inclusion, and even if we think that esports or this kind of digital approach is not accessible to children of the kind of communities we serve, we need to invest as in the sector, and that's where the funders need to look at it. We need to invest in building capacities for us for the next pandemic, because this is probably not the last one we are having in a year or two. So, and once we scrambled, this time we scrambled, but the next time we should not need to scramble. We need to have teams ready with resources, with data from children, contact, and children having those devices probably for us to keep in touch, be in contact, so that we, as in one of the things, in India, we say we are, as in it's a graveyard of pilots, great pilots. We are also a graveyard of good intentions. Report after report, we, come across the same problems. So probably now is a time where we start moving funding. That is one of the things that one would urge very strongly. If we are to go in any meaningful way of digital experience for sports, we to do it in 2025, we need to start it today. Probably we should have started it yesterday. And that's where I would expect. And broad-basing sports through Khelo India, Fit India, And like Juan Pablo said, focusing, front loading the health benefit of it is going to be there. I would also add that we were here, we are in the sector for a reason, because we believed in sport, how we saw it and how it was experienced. So I have very strong belief that that first love, which draw so many of the organizations in this, and so many of our individuals, our friends, colleagues in this, will continue to be there, and that is going to be one of the greatest assets in engaging with civil society, governments, and funders. Thank you.
Excellent. Thanks. I would like to open the floor to any questions. So again, any of our participants, if you'd like to ask a question, you can raise your hand virtually, and we'd love to get a couple of questions before we wrap up. In the meantime, there was a very interesting question. I think Deep has touched upon esports, but there was a question from Alexander Matthew asking about would the involvement of parents and video game apps like Pokemon Go, can that be used to encourage physical activities in exchange for a virtual delivered reward? Any thoughts of the panelists on esports? Or
I mean, I would be completely for gamification as a platform for learning in general, and that would be a type of solution of what I was calling innovation and repurposing of what is already there. Of course, with this type of issues, we would need to be like very creative on how best to engage the parents in that sense. And we have seen that parents in general and guardians are now taking into their hands also the education of their children, because now that learners have stayed at home, this has been completely shared between parents, guardians, and teachers. So of course, utilizing innovative ways to engaging them into physical activity for students, learners, children, boys and girls in general, I think it would be a very good solution to enhance in general physical activity. And I don't know, I don't know if I agree with the fact that students don't have interest in physical activity. Yes, gamification is a good thing. Maybe they don't have interest in one specific sports or a game that it's being given to them. But I think that in general, students have a clear interest in physical activity. And right now, staying at home, they are eager to move and eager to have more and more opportunities to do sports. So it's just like with anything in life, motivation comes from finding what we like to do. So it's just about trying to promote more and more opportunities of exploring what is the right option for us to move and to play.
I'm just wearing a mother's hat now, and it's very challenging. I have a 13-year-old son. It's not an easy situation, because now you're really dealing with a lot of screen time, and you're trapped at home, and a lot of this content that was created wasn't created keeping this kind of a scenario in mind. It's a big challenge as a parent to be able to monitor the kind of content that your child is having access to. So we've been talking to counselors and all, in parent teacher groups, constantly engaging to see how best to go forward. And it's a difficult and challenging time, because even schools really don't know how to go about it. There are some WHO guidelines, I think UNESCO has come up with some guidelines on how to manage children's screen time, but a lot more parent engagement and education is required, because I think our kids, those who have the wherewithal, are actually much smarter than their parents. They know a lot more about technology, but as parents, we have to also be responsible for their safety. So I think that safety element is something that we do have to, deal with.
I completely agree that, when we, in our common conversation, when we say digital, anything digital, we commonly assume this phone or a tablet that's there. And like Laura very rightly pointed out, tablet, phone is not meant, it is not designed to make you physically active, except for your thumbs probably, and fingers. However, there is also stuff like, say, Nintendo, Wii, where you actually have to exert yourself. You can play those tennis and say cricket there. In my past experience, although it was not for, say, low income families, but in my past experience for a school setting, sort of middle income parents, there, we saw this opportunity of having this kind of a Nintendo / Wii kind of a machine, and with a screen and with a joystick, students can literally play something on the screen, and that involves quite a bit of physical exertion there. Now, of course, it's not a one-to-one correspondence. We cannot take something like that immediately, because now even touching requires sanitization. However, the point is, I'm pretty optimistic about this, and like Laura pointed out, there is a huge need for us to study the way we design games, the way we design engagements, which is usually one-way consumption, or say a mindful, slightly not mindful, a slightly mindless, repetitive sort of task of tapping or directing. So huge scope for content, new kind of content, new kind of interactions that's out there in terms of esport. But specifically Pokemon Go, well, you just walk around in this, to be honest. So I can't really visualize it right now, but a version of Pokemon Go where you have to like physically catch something would be something interesting. It uses augmented reality, right? So augmented reality on your phone can be used for more physically exerting, even in a small space. We can create stuff like that, definitely. Thank you for the question.
Excellent. Thank you. I mean, we have tried to integrate as many questions within our discussion. I see no hands, so I would thank you, Dr. Bandyopadhyay, for waiting patiently. But maybe you can summarize the crux of the discussions and point out some of the highlighted points raised by our panelists during the discussion.
Thank you, Sohail. I think it will be a hard task to summarize this very rich discussion. But let me take this opportunity to thank Pro Sport Development for choosing PRIA International Academy as a partner in this fascinating conversation. I think they spoke so wonderfully, and their insights and reflections were pretty useful. Let me focus on a couple of points that came out of this discussion, and I think, and you have to take my reflection as a kind of non-expert, distance observer kind of reflection. I think there are two streams of conversations. One about the sport itself, and I think all three of the panelists have pointed out some of the fault lines within the existing sport. Somebody talked about it as a top-down. Somebody talked about it as a kind of elite-driven. Uh, one discourse is around the sport itself. But what was also interesting was the discussion on using sports uh, thoughtfully, consciously for development. And to my mind, sports for development as a discipline being comparatively a new approach to sustainable and equitable development. But in a shorter span of time, its positive contributions are discernible, and the initial results made us believe that it will continue to contribute to addressing some of the most entrenched inequalities in our society. Uh, be it is in the field of education or health or environment, and as Laura eloquently pointed out about the gender injustice, existing gender injustice in our society. But to my mind, sports is also a great leveler, and therefore um, it has a great role to play in a society where we also have a greater inequalities. Uh, Now, the hypothesis is as simple as that. That if the sports for development itself is affected by the pandemic, then the development outcomes will be affected too. So and if we place this hypothesis in front of us and argue that um, we must continue with this approach, and as it has shown positive results in reducing some of the inequalities, and I completely concur with Laura's observation, and when she says that it will be so difficult to bring back the girls uh, in the field of sport. Um, Basically, we are moving towards a kind of regression, not necessarily a progressing towards that development. So we have to address those questions. The second point that came out very strongly is that of mental health and mental health across generations. But to be particular, the schools being closed, and schools of all varieties, whether it is a low-income school, middle income schools, or high-end schools, all those schools are being closed. Uh, we could see the restlessness among the children, and which in a way negatively contribute into the mental anxiety and lack of physical activities for the kids. And therefore, we have to take this into account. And I think Deep has very eloquently said that the use of sports is not only for mental health or health per se, but the overall um personality growth of a child. And therefore, if the sports for development approach suffers, then the a sound growth of a comprehensive growth of a child will also suffer. Um, I think there was a discussion around public space, and I like this discussion because a few days back we organized a webinar to look at how pandemic can influence the urban planning or city planning process, and we are particularly looking at how the public spaces will be reconfigured, redesigned in order to be prepared um, for a pandemic situation like this. Um, and it's not about Delhi or Mumbai or Calcutta or some of the more prominent cities, but across Indian cities, you will see that of football ground, that of parks, and therefore people coming out and participating in the sports activity. Kids are coming out and participating in the sports activities is affected quite a lot, and therefore we need to bring back the discussion in a much more integrated fashion, where we need to look at the planning issue, the public space issue, and how we can integrate the practice of sports for development discourse and practice. Lastly, one of the points that I would like to mention, I think Deep has pointed this out. In addition to advocacy at the state or national or international level, the need for engaging with the local institutions, local actors, and at the community level. I completely concur with this idea. But at the same time, perhaps we need to take a more public educational approach towards the advocacy. And therefore, coming back to our original hypothesis that um, if sports for development as a sector suffers, then the overall development outcomes will also be obstructed and hindered. And therefore, to continue to push for more spaces for sports, more engagement with the sports could be a useful advocacy point. I know that we have crossed our time, so let me stop here. Once again, thank you so much to all the panelists for their tremendous insightful sharing. Thank you, sir.
Thank you so much, Dr. Bandyopadhyay. Yeah, so I just that was, I think, a excellent way to sum up our discussions. Just a few things for everyone before we leave. The recording of this webinar will be available on our social media channels, especially YouTube. We'll send out the link to everyone. And we will also be preparing a report for this. So again, we will be sending out that to everyone as well. There's a short poll that has just gone live, so request all of you to just participate in that. And just a couple of announcements. As Juan Pablo had mentioned, we are delighted to inform all of you that PRIA International Academy, in collaboration with UNESCO and Pro Sport Development, is launching a online course for sport for development, basically in mid-June. And also another announcement, and we'll keep you updated, is we're going to do a short free module for that course in the next couple of weeks. So we'll keep you updated. And if you'd like to know more about the course, I'll just ask my colleagues if they could put the link and you can have a look. So yeah, and finally, thank you so much to all three of our panelists, Laura, Deep, and Juan Pablo. Thank you for your time and your deep insights into this ever-evolving crisis and the impact it's having on the S4D sector. And then obviously to all our attendees and participants, thank you, and thank you for your very thought-provoking questions. Great. Again, thanks to everyone, and be safe, take care, and hopefully we can all be back on the sports field soon.